emotional intelligence before? Yes, I see some hand nods. So this is an important skill, as she mentioned, to carry into your profession and to carry into your everyday life. And being emotionally intelligent can allow you to be more empathetic, and that's what we want to talk about today. So, here we go. Here we go. All right. So by the end of this class, I hope that you guys will be able to explain the importance of empathy and emotional intelligence in nursing care delivery. I also want us to discuss changes that can be made with empathetic communication skills to respond to a patient's emotions during a case study that we're going to review today. And also, I want you guys to be able to demonstrate behaviors, caring behaviors, using the heart, head, heart sandwich technique. By show of hands, anyone ever heard of this technique before? Heart, head, heart? Yes? No? It is a great tool that has tremendously helped me in my practice. So we're going to really focus on that today. If you guys have access to your cell phones, could you pull them out for me and go ahead and scan this QR code? I kind of want to gauge how you are connected to empathy right now. Oh, I'm sorry. I don't have any other way to do it. But we'll be able to see the details and share all the information. Listen, usually takes about 1 to 2 minutes to complete.
You did it?
Yeah, I think
Zoom in. Keep zooming.
if you need to come closer, you can. Try to make it as big
Make
as
sure
I
pick up
could.
that Google Docs. What's that they It's right here.
Come up.
Yeah, the little yellow thing that was here.
You got it?
Yeah.
Most of you guys have it?
Thank you.
Are we doing this now? We doing it now?
Yeah, go ahead and I want you guys to fill it out right now. And then at the very bottom, make sure you hit submit. And it should look like this. Everybody have it? It's like see some responses coming through. So once you're done, you can come on and look up at the screen. We'll see what we're gauging. A lot of people balancing compassion while maintaining professional boundaries, yes. Dealing with the pressure to perform, feeling overwhelmed. Everybody submitted? We're still working on it. Okay, so looks like everyone is really having trouble or finding difficulty with balancing compassion while maintaining professional boundaries, and that is a work in progress. And the majority of you also feel overwhelmed by your academic demands. That is also, and then feeling disconnected and unable to relate to others. So we're going to talk about how we can better achieve some of these things. And what are you doing to respond to your emotional challenges? You're talking with your classmates, that's a big one. You also are seeking support from your peers and your instructors, utilizing stress management. Okay, you guys are pretty aware of empathy. So let's get back to here. Get this larger for you again. So before we actually get into the nitty-gritty of talking
shouldn't make you, you know, like if you treat them mean, or you know, if you're just treating one person one way and another person another way, or somebody treating you one way and treating another person another way. It could be them going through something and not necessarily, you know, their reaction. It don't have to be, oh, because they don't like you. It could be they're experiencing something, so their attitude is just that for that day, because you never know what people go through. So.
That is true. I've seen that video many times, and it still gets to me. So,
The baby and the mom, that was missing yesterday. So I understood what she was going through, because every day we get to the hospital, there's one bad news or the other. So you cry every day.
yeah.
So you tell people what you're going through, but because they are not in your shoes, they don't really know what you're going through. But the pain, the loneliness is overwhelming, it's exhausting. So I really know, especially the baby and the mom, that was
And this is why empathy is really important.
And some people will understand what you're going through, but people grieve different. You know, people feel different. So, like yesterday was my grandfather's birthday, and not many know that last semester I had to bury my grandfather. You know, so like it was a period through when we was on maternity leave where I'm coming to class, but you know, still smiling and everything, but nobody knows that when I leave here, I gotta go make funeral arrangements and everything. So, and the same with my mom. Like now we getting down to the wire, about to have graduation. I lost my mom 3 years ago. So, you know, me being her oldest girl, the first of her 7 to graduate college, you know, that's, you know, taking us over. It's a lot that's building. So it's like, you know, you try to be strong, get through it and everything, but you still gotta realize, you still have that thought in the back, like, dang, I wish she was here.
It's a memory.
You know, yeah. So
Thank you
it's
guys
a lot.
for sharing. That's right. So these two terms, as we talk about it later on, you'll see the difference. So sympathy and empathy are related. However, being sympathetic is like a superficial level, right? Because you're feeling pity, you're feeling sorrow for someone else's misfortune. Whereas empathy, there are different layers. And that's the ability to understand and share feelings of another. So you can be behaviorally empathetic, cognitively empathetic, and also have emotive or affective empathy. So that's the major difference between those two. So you don't want to be superficial in our practice. You want to be, you know, get down, uncover, peel back those layers and be much more empathetic. And this is really beneficial in more than just the aspects of your career, but in your personal lives as well. So as I was mentioning, I don't know why this keeps coming up. Hopefully it'll go away. Here we go. So we have affective empathy, also known as emotive empathy, right? So it involves the capacity to share psychological needs of the patient. So, why is this important? As I just mentioned, we're dealing with the holistic picture of our patient. And this helps facilitate patient-centered care and interactions, and it improves their outcomes. And that's what we want to do. We want to always achieve and improve patient outcomes. And it's also linked to reduce depression, anxiety, and distress among healthcare professionals. And I can attest to this, right? Because I wasn't always emotionally intelligent, and I'm still practicing it. And I used to have a lot of stress because I didn't know how to manage my emotions until I learned the tools and realized that there are resources to help me better achieve this. And it's the foundation of understanding your patient's needs, concerns, and emotions. And you can easily fix something physiologically wrong, but can you easily fix the psychological part? Not so much. And then it also enhances the quality of therapeutic relationships. We want that therapeutic communication with our patients. You want them to be able to openly express concerns, right? Equal exchange of information. And it increases the emotional well-being, satisfaction, and treatment adherence. You ever heard that saying, it's not what you say, it's how you say it? Sometimes you can get patients to do what you want them to do if you ask them or say it to them the right way. So it's your word choice. And I've learned that too. You can bring down their emotions. They can be up here, and you can use certain trigger words to help them relate to you and you relate to them as well. And we're going to talk about that. Any questions so far? I don't know when I tap this, why I keep showing that. So, why is all of this important to you at this level? Right? You're entering a very emotionally laborious, tolling profession. Even within your current practice in your studies, it's a lot of emotion connected to it, right? So how are you processing your emotions and how are you dealing with this? So I wish I knew about this when I graduated. It would have helped me so much. And I just want to bring this information to you guys because I realize that there's a little need for this to going back to understanding that you want to, again, psychosocially and psychologically help your patient. As I mentioned, our profession is an emotionally laboring profession. And it's necessary that we can manage our emotions to maintain professionalism and compassion. I can attest. I've had episodes where I didn't know how to do this. It's not a good look. It didn't make me feel good inside. Not at all. And I wanted to get better with that. And I'm still working on that. You know, in emotional labor, it requires us to express, conceal, and regulate our emotions, as Natasha was mentioning, right? And I thought that this picture was perfect for that. Because someone on the outside, they can be so excited, happy, and inside you're dealing with so much, but you have to mask that in a healthy way. And how do you do that? And it takes practice to do that. And you have to put on this facade in a healthy manner. You still want to be able to decompress in the correct way. And this involves coping with our healthcare demands, foster relationships, and providing quality care. So we're dealing with so many people. We're dealing with so many different types of emotions. And it can be tiring. Oh my goodness, it can be tiring. I say the emotional mental load that I sometimes carry, like when I'm in a position of charge nurse, is I just need to take a moment and take a breath because it's a lot. And now that I've learned these tools, it's helping me better cope with all of those needs and demands. So what is emotional intelligence? Right? It's a revolving circle. You're doing it on a intrapersonal level within and an extrapersonal level without, or with other people, I should say. We're always trying to manage our emotions. We're understanding our emotions, using our emotions, and then we're perceiving our emotions. At the same time, we're trying to do this for other people. Sometimes it can be a lot to juggle, trying to figure out what's going on with you or trying to figure out what's going on with someone else. But once you learn how to regulate these things, it'll get easier and easier with practice. So how do we do it? There are 5 doing for yourself? Morally, that's my big thing. How do I feel when I go to sleep at night? Do I feel bad for how I handle that situation? You know? So that's a big one, and that's always a work in process. And then that big word, empathy. How are you connecting with other people's emotions and not just in a superficial level? And this one right here, self-regulation. Very, very, very important. How are you achieving homeostasis internally? I learned that in therapy, right? You know, what do you do? Do you exercise? Do you garden? Do you travel? Do you hang out with your family, your friends? What are you doing to make yourself feel whole? And honestly, I thought I had good self-regulation skills until last year. Last year, I had a work-related incident where a patient stalked me on the internet, threw me for a loop. I couldn't talk about this for months. You know, it really took a toll on me to a point that physiologically it was affecting me. I couldn't eat. I couldn't sleep. I was vomiting. Everything that I typically do didn't work. So I had to go next step higher, therapy. Give me those tools to help me self-regulate. And that homeostasis was a big one for me. So that right there, sometimes it may change based on what your needs are in that moment. So this is a revolving circle to help you become more emotionally intelligent. I apologize, I have no idea why I slurred today. Okay? Key words. I want you guys to remember these things. Any questions so far? Yes, no.
No.
With me?
Can we get the PowerPoint later?
Sure. I'll send it to you guys. So we've talked about what empathy is, why it's important. We talked about emotional intelligence and how that can help us become more empathetic. Now, how can we demonstrate it? Today you have a lesson. Okay. Active listening. How many of you guys are actively listening to me today? Anybody? Yes, no. So, we're listening with our ears, but there are physical things we can do to demonstrate that we're actively listening to people. Transitional phrases. Things like, I see, tell me more. That probes the conversation, saying that the person talking to you, that you're listening and you genuinely want to know more. And that encourages them to continue to speak about it. And then we have parroting responses, where you're literally saying verbatim what that person is saying to you. I do that a lot personally in emergency room when I hear a verbal word. A doctor will tell me one thing, and I say it back to them. So we're exchanging information so we both can hear it. And if there's anything wrong, we can clarify and correct it. And then you have paraphrasing, which is a big one. So when someone's talking to you, can you say in your own words back to them what they told you? It shows that you're processing the information. So this is a tool I've learned to do in my professional life, but when I bring it home to my husband, he's like, why you keep saying the same thing? It irritates me. It's so annoying when I do it, and it's hard, right? It's hard. Your brain, I'm rewiring my brain to do it, and it becomes a habit, a good habit, but he can't stand it. And it's hard for me to make the distinction and separate it from home life and work life. But it's a good tool. And then reflection of feelings. Who in here wanted to be heard, wanted to be felt, wanted to be seen? None of y'all? Thank you. None of y'all? None of y'all? We've all been in that position when we wanted somebody to just understand how I feel, right? So you want to be empathetic. You want to reflect on that person's feeling. Acknowledge that they're going through something. That does so much for people, right? You go over, somebody looks so upset. If they allow you, you hug them. You ever got that hug? You were here, and you just melt in their arms because they acknowledge your feelings, right? So that's really important. And then emotion, right? That plays right into emotion. Are you being empathetic? Are you being cognitively, effectively, and behaviorally empathetic? And that tells you your level of compassion. Being kind, showing acts of kindness goes so far. And this may seem like, oh, I don't have time for all of this. But if you make time for this, if you create a little space to address the psychological needs and the psychosocial needs of your patients, it'll save you time on the end, right? It'll help you prevent or slow down a catastrophic blow-up if you address this. The same way if you're addressing the physiological issue, you notice that there's a trend, something's wrong, the patient's blood pressure's dropping, and you intervene. You you acknowledge it so you can try to prevent something bad happening. Same thing, same practice applies here. And then consoling your patients. Or you're consoling your friend, you're consoling your coworker, you're consoling a family member. This goes in so many different levels and involves so many people. Are you expressing your emotions appropriately? Right? I can't have a patient come up to me and they yelling at me, and I start laughing in their face. Is that appropriate? Absolutely not. Right? So you want to make sure you're appropriate with your nonverbal cues and your verbal words. And then lastly, talking about those nonverbal cues. There are things you can do to show or demonstrate that you care. If I'm like this, talking to you right now, do I look like I'm interested in this presentation? No, right? Open hands, open stance. Leaning in. I see this a lot with the doctors. They come into a patient's room, we'll have a chair right here. They come in, hey, Miss Smith, how you doing today? They sit down, eye level with the patient. Makes them feel like we're talking together and not at each other. Eye contact, really important. It's important in our culture, in American culture, that we do this, and it shows that you're listening, you're attentive. In some other cultures, you have to be culturally aware, culturally sensitive that this is not appropriate. So cultural sensitivity is a big thing, and that's a whole different topic on its own. And then head nods. I am a head nodding queen. Okay? I will do that, and I'll do eye contact so I can make myself consciously aware. Like I'm probably looking into a lot of your eyes today. If you're looking at me. Because it's shame I'm trying to connect with you. Right? I want to make sure I'm listening because I do have adult attention hyper ADD. No, I can't even say the words right now. But I get a little sidetracked. If I pull out my phone, am I listening to you? No, I'm not really listening to anything you're saying. So, show that you care. Any questions so far?
On the part of person, is the same like stating what the person says, right?
Mm-hmm. And it's showing that you, I process what you're saying to me. So there are actual trigger words or phrases, stem phrases, that you can say. Sorry, technology's not my friend. Here we go. That you're exhibiting empathetic communication. Right? How are you expressing it to them? You want to say, you look relieved or you sound worried. Try to stay away from I understand what you're going through. Cognitively, it's easy for that to roll off your tongue, but you really don't understand what they're going through. And I had somebody say it to me before. You don't know what I'm going through. I am so sorry I said that. I did not do what I needed to do in that situation. So, trying to be aware of the words you use, okay? And then you're acknowledging their feelings. I can see why you may feel that way. I like to keep that one right there. I don't get myself into trouble by going any further than that. It's a good phrase to practice. The blameless apology. Oh my gosh, I do this all the time. All the time. Sometimes you may be the person that they vent to, that they may be angry with or sad with, just because you're there. That's when they just decide to unload and unpack. So you can say, I'm so sorry this has been painful for you, or I'm so sorry that this is happening to you, because you are apologizing for whatever that may have happened. And it may not even be your fault. But this is enough to make somebody feel better. I don't know if you've ever heard this term before and it made you feel better, but it made me feel a whole lot better when I heard it. Again, you want to take them at this level of cognitive, emotional overload and bring them here. Because if somebody's up here and you're here and you're trying to meet their needs, it's not matching. You want to be equilibrium, homeostasis with them, okay? The collaborative approach, the other one that I like to do. I want to work together to make you feel more comfortable. We're here to work together as a team. This is important because when patients or visitors, they come into our hospital, we take away their autonomy, their sense of control. We tell them when to eat, when to sleep. I need you to pee in this cup. I need you to take this pill this time, right? No sense of control. They get irritated. I get anxious when somebody keep telling me what I can and can't do. So I'm grown, right? So you want to showing that you are supporting them, even though they may not want to talk to you. Little things. Little things. I'm telling you, it's going to make your nursing career so much easier. Any questions? So, this is a great video that shows the difference between listening to someone and how you display your empathetic communication and your sympathetic communication.
Hey, it's gonna be okay. We can fix this. We just need to get back to headquarters. Which way to the train station?
A whole trip planned for us.
Hey, who's ticklish, huh? Here comes the tickle monster. Hey, Bing Bong, look at this. Oh, here's a fun game. You point to the train station and we all go there. Won't that be fun? Come on, let's go to the train station.
I'm sorry they took you. They took something that you loved. It's gone.
Sadness. Don't make it feel worse.
It's what I have left with Riley.
I bet you and Riley had great adventures.
Oh, we were wonderful. Once we flew back to Hawaii at breakfast twice that day.
Sadness.
Sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends. Okay. Come on. The train station is this way.
Did anyone notice the difference that they're willing to talk about and want to share?
Sympathy and empathy.
Yeah. What did you see the difference?
Understanding and then feeling. So different.
Okay. So this is from the movie Inside Out. I have kids. I don't know if any of you guys have seen it before. They're inside Riley's body and their emotions. So sadness was the blue one, and then happy or joy. Joy was the other one, and then that Bing Bong. I didn't remember their names. He's a memory deep in her subconscious, like a memory that the person has suppressed, right? So joy, she displayed. I see that they're sad, but she tried to, get them to change their mind. She didn't, she was very superficial in how she was approaching Bing Bong. However, sadness, she said those words, "I'm sorry." Immediately say, "Okay, somebody cares about my feelings. They want to know what I'm going through," and she tried to relate and connect with them. So I just thought that it was a really, really good video, right? Big difference.
And the touch.
Mm-hmm.
There was the touch.
Yup, the touch on the back. That's right, the power of touch. Well, you have to be careful because everybody wants to be touched. If the gauge, you gotta read the room. What's your social cues that it's okay to touch someone? So now we're going to talk about how can we demonstrate all of these things that we learn. And this is this heart communication tool. Sorry, y'all. Here we go. So this was developed by the Language of Caring model back in 2014. I think the organization is now called Plant Tree Organization. And this technique, oh my goodness, it is wonderful. I love it. There are different communication techniques. I just find personal satisfaction with this one, so I wanted to share it with you. So when you're speaking from the heart, right, you're being emotive. Let me get the words together. Emotive, right? So your patients, your families, your peers, and your coworkers feel valued, supported, and encouraged because you're trying to recognize their emotions, whether it be angry, frustration, sadness, whatever. And then this approach enables them to comprehend the factual information we provide. Because typically we're so fact-based that we want to come in and say, this is what I got to do because A, B, and C are the outcomes. But sometimes they're not ready to process or hear that because they haven't psychological part, right? And your patients, your families, your peers, and coworkers, they can receive that information. And it allows the opportunity to express gratitude and also clarify some things, right? If they feel comfortable with talking to you, they may be comfortable with asking you a question. Because sometimes people will shake their head yes and have no idea what you're talking about because they don't feel comfortable in their conversation to actually open up to you. So we're going to look at that again right here. Your heart, head, heart statement is a sandwich. Don't go away. So your emotion, your caring, your empathy. That's the first statement. Then you come in with your task, your information, your analysis, you're explaining whatever fixing you need to tell them. You give them a statement right there. And then you close with another statement that expresses your emotion, your caring, your empathy. I'm going to go ahead and practice that. Okay? I want to pass out some papers. And we're going to go ahead and talk about a case study. Oh, I jumped the gun.
I did.
I'm too fast.
Yeah, okay.
Before we talk about the case study, I actually want to see you guys see this in practice. Because heart hit heart is not a technique that we always just use with our patients and our families and our visitors. We can do it with each other. So this is an example of it. This is from the plant tree.
Team members, including providers, are often very solution focused and respond mostly from the head with colleagues. Here's an example.
I'm reviewing the test results on this patient, and I'm struggling to find the cause of her symptoms.
Don't overthink it too much. You can just leave the chart to my office. I'll take a look. And I can give you some recommendations on what the next step should be.
Okay.
Head messages don't make other people feel our compassion for their situation. Feel the difference of both opening and closing with heart in this response.
I'm reviewing the test results on this patient, and I'm struggling to find the cause of her symptoms.
That sounds like a complex case. As having worked with you, I know you take the time to look at all the factors and find all the best solutions. Maybe we can find a moment to look at this together and then we can discuss what the next steps will be. Yeah, I really appreciate how thorough you are and that you ask for help when you need it.
That would be great. And thank you for noticing.
There was a lot of information in here really quickly. But I don't know if you noticed, it looks like, I don't know if she was a doctor, whoever it was, she just went in with straight logic. That's the way a lot of us operate, right? And the left, that other person, you know, like, okay, well, she really listened to what I had to say. So you want to practice these skills with your colleagues. And I can attest, I wasn't always good at this, and I've gotten a whole lot better. And it's a work in progress, especially because you guys are going to be moving into a different environment. You're dealing with a whole different group of people. You got used to each other. But now you have to go deal with so many other clinicians, not just nurses, doctors, technicians, CNAs, phlebotomists. You're communicating and you're relating with so many people. So these skills are really helpful in those interactions. So here is a case study that I jumped into quickly. So first, I want us to talk about this as a class, right? So this is our patient, and I'm the nurse. I want y'all to critique me on how I talk to him, okay? So we have technology not running. All right.
eye contact level, you know, that eye level with him. And express your concern for his loss in a different manner. Not like, oh, okay, yeah, sorry for your loss, here's some tissues, let me call somebody for you. Like, you know, instead of like, do you want to talk more about it? Do you feel like how you say, you know, do you want to talk about it first? To try to gauge to see where he is, and, you know, then feel with him and not just be like, oh, yeah, sorry for your loss, but on to the next, let's get this medication. Like,
And then body language.
My body language,
yeah, 'cause you
right?
got
My
the
nonverbal
calls
cues.
when you're wrong, like, what's up, Mr. James? Basically, like, that's what it was
What's
getting
up?
at.
How you doing? Right, you good? So I gave you guys a piece of paper. I want you to go back to the first page for me, right? And then it is an example of how I could have potentially handled this a more appropriate way using my heart hit sandwich. So Deborah, if you could read the first heart statement for me, please.
Jane, do you want the scenario too?
No, not the scenario. If you go down to that heart statement, read that first one for me.
Okay, I can see you're feeling upset. It must be tough to cope with your symptoms while also dealing with personal challenges. I'm here to listen and support you through this.
You hear those words? Hannah, could you go ahead and read the second statement for me, the head statement?
Let us talk about your medical history and medication. We need to understand your health needs fully. Can you tell me about any previous condition or treatment you have? Also, are you currently taking any medication?
Right. So I addressed the emotion part a little bit nicer, and then I went in with the head statement, and then Frankie, can you do the last one for me, please? The last heart statement.
Yes. So I want you to know that we are here to help you manage your health and provide support during this challenging time. Dealing with personal loss is difficult, or a loss of difficulties is never easy, but together we can find a way to ensure you receive the care and support you need.
All right. You guys hear the difference? So sometimes we have to be a little bit more long-winded in our statements, but again, if you take that time, it really helps on the back end for your patient. Or talking to a coworker or a family member. With practice, I personally can say that this has worked. Because I've seen it, I've done it. I'm still working on it. No one's perfect, and there's no exact right way to do it, but if you try to be conscious with the terms you use and making sure you're following that, it becomes natural to you. So right now, I want us to go ahead and practice. I feel like I'm missing a slide. I want us to practice. We're gonna go spend about 15 minutes. I want us to work in pairs of 2, actually. And for time purposes, I want you guys to work on the first scenario.